We're going to talk today about how I'm going to fix him over the course of the next basically 3 months on his low back and herniated disc issue. And how long have you been dealing with this for?
It's been over 4 years that I've been suffering. I went through therapy, chiropractors, acupuncture. Nothing helped. They told me I needed surgery, and I didn't want to do that. So luckily I found you.
And you've been coming now. We've been here for about a solid 4 weeks. And how much better does it feel? Now, you've been dealing with this for a long time. And now we've only been doing this for 4 weeks. How much better does it feel?
I would say at least 30% better. And I can only see it getting better the way we're headed.
And like you struggle to even like touch your toes or anything. And go with a lot of pain. And now go ahead down.
Oh, absolutely. Before that would have set me off.
Okay. And that's no issues there.
No.
Right. So this is going to be a long process. When you're dealing with a herniated disc, like what we're going to do is I'm going to take all the pressure off of it over these next couple months so we can allow that disc to heal. And you deal with a lot of nerve issues too. Kind of shoots down your leg and you get numb. And that's also improved like 20 or 30%.
Oh, yes, it has.
So we're going to take all that away. So all he's dealing with basically left is just some pain in his lumbar, which is going to take, 6 months to a year to heal. But we're going to get him in the position where he's not going to be as vulnerable and he's not going to be dealing with all these issues that he's been dealing with for so long. So let's go into it.
Okay.
So what we're going to do is we're just going to bend his knees a quarter of the way here. Okay, we're going to take a 2-inch thick pad. We're going to stick it there. You can also use a towel. He's just going to touch his knee to the floor and he's going to establish his hip angle. Now what we're trying to do is we're trying to get into, if I squeeze my butt cheeks together, there's a side dimple here, half moon shape right here. That's your glute medius, and we want to attack that to take pressure off the lumbar spine. I believe 99% of all injuries in the lower body, and especially in the low back, this is your support structure. If this is off, low back, lumbar is going to be affected, and that's when you're going to cause a herniation. So that's why this is so key to get this one muscle active. We have another glute exercise, but this is the basic position here. Now, go ahead and just show him. He hasn't passed the test yet, but just go ahead and just do the movement. So he's keeping this hip angle forward like a couple inches, okay? And he's trying to get it to the top of his hip without this movement here. And it's a very struggle for him, but when he started, go ahead and show him. You could, right here to here. And that's all the movement pattern he had. But now, over the last month, go ahead and show the movement pattern. Now he's starting, so his glute medius now, right at the top there, he can really squeeze and fire. I feel it, it's hard. Okay, rest. In order for him to pass the test, go ahead, come up and just hold. No, up high, as high as you can. That's pretty good. So he's got to get another couple inches here. Go ahead, try to fight up. He's got to get it about there. So it's a little bit above the hip line with 7-8 pounds. And then we know his medius is firing. And then there's a whole other exercise that we move on to, but this is our foundational exercise to know, okay, the glute is healthy, it's firing. Now we're going to hit it with some other different ranges of motion, with different types of exercises where now you're on the floor and you're moving your leg like that. But band hip walks, clamshells, none of that stuff works. It just causes more compensations. This gets directly into the spot. That's why I can create such a dramatic change in him in a very short period of time if he can isolate these techniques. So I talk about how bad it is to stretch in the initial stages when you're working with a client. That being said, I recently had a new client that I'm fixing for the shoulder, but he's teaching me a lot about stretches. He's a contortionist. His name is Jonathan. We're going to put a link in so you guys, if you want to see some of his stuff, you can. But this is all about squeezing the glute. So you're getting the glute stronger while you're opening up your hip flexors. So this is one of the stretches. We're going to show you the 3 stretches that I did with him to start opening up his hips. But very simple, okay? He's just going to be in a nice straight line here with his leg. And this will be at 90 degrees. And now all he's going to do is just squeeze his butt. Squeeze your butt and feel the stretch right down the front of the hip flexor right here. Okay, that's where he wants to feel this. Squeeze and lean back. When you lean, so you want to get involved that psoas, where the psoas tucks. It's right in the front of the hip here, and it goes into the back line. So we want to arch back when we're doing this, so we can really stretch that out. And you're just holding it. Just hold it for 30 seconds, and you just get a nice squeeze. You don't have to go nuts. Eventually, over time, you want to be able to squeeze this like 80%, feel a nice stretch, and then you can start moving forward. But for now, you just got to go where you're not going to hurt yourself. And everything train tracks, we're trying to keep the hips in great alignment. That's part of the process with this. So notice how nice and straight he is. And you want this knee a little bit caved in this way. And then you're squeezing your butt. Okay, find where you can squeeze your butt and you just feel a nice stretch down the front of your hip flexor. That's all he's trying to do. And then leaning back. And the goal on this, and I can't do it yet, but the goal on this is basically to be able to get to 45 degrees forward, 45 degrees back, and be able to really squeeze your butt when you do this. And this is the basic setup and step. Push this down. You really want to try to push down with the back foot here too. Okay, that helps engage the glute more. You feel that?
Mm-hmm.
That's what you want to do. All right, rest. So what we want to do is when we're starting with this, it's called the half frog. Okay, we don't want to be at 45 degrees. You want to make sure this ankle's not in. You want to keep it out. That creates more medial rotation when you're doing this, more internal rotation of the hip. Okay, if it's in here, it's not going to be as good. So you want to be here. This foot just stays nice and relaxed. As you get better, this will turn in. And I have a block here, this 2x4. You want about 1.5 inches. What he's trying to do is, if you want to get over here from the side, babe. Now what he's going to do is he's going to squeeze his butt. He's going to drive his hip down into this block of wood. You feel? Hold, just hold. And put your hand straighter ahead, remember? Nice and straight, and try to push it together. Yeah, when you push together, it helps you kind of rotate your hips down. So he's trying to drive that hip down, and he's trying to compress this, which he's getting better at. That's pretty good. So once you can really press into this, then the next level is, go ahead and relax. We're going to move up a couple inches. A little bit more, right there. And now you start back over. That's probably not a bad zone for you to be in right there. But see how he can't touch this yet. So once he can touch and compress, then you move it up. And the goal is to kind of, he's not ready, but move it all the way up. The goal is to be able to get this knee right in line with the top of your pelvic bone here. But for him, he's going to start here, a little bit above 45 degrees, and be able to compress down in. But he's getting it. I mean, when you first started, you couldn't even move. He couldn't even move the hip down. So we're just getting the hips to open, you know, with all the pressure from the herniation, that psoas muscle. That's why this one's so important. That psoas muscle just locking down on him. His piriformis is locking down. That's what's causing a lot of the sciatica. So we got to just get this thing to open up. All right, that's good. Rest. So what we're going to do with this is put your foot just a little bit out there. And he's been doing this for about a month, okay? But so when he started, he could barely rotate. But take this about a fist up off the floor, your knee. Good. We're going to squeeze this bottom butt cheek, and he's going to be pushing up into his hand, and he's going to rotate his head back, stay arched through the thoracic. That's about where you want to go to. So he's pushing up into his hand. Okay, that's why we have the ankle weight, not a weight, because he's pressing and he's creating torque, and you should feel it through his glute medius, but he's also going to feel it stretching out his lumbar spine, his thoracic, and you really want to go where your head's turning you. And again, I've learned these techniques from Jonathan, so you know I'm just getting better and better at them as I'm learning to teach them. But this is phenomenal for being able to open someone up who's been tight for so long, because you're using the strength of the glute. Like I always say, that's the most important thing. If you just stretch normally, you're not going to be strengthening the glute. This helps you at the end ranges get that glute firing that our system can't do. That's why this is so valuable, especially for a herniated disc. Feel it?
Mm-hmm.
That looks great. So again, about a fist, okay? He's really concentrating on turning that head. You really only want to go where the head's turning. So my goal is to get his head, you know, to turn almost to 45 degrees. And eventually, he's going to take this pad out. Are you ready to take that pad away?
No, not yet.
All right.
But we're a lot better.
So these pads are about 2 inches off the ground, so you really want to start like that. But eventually, you can get rid of the pads. But he's opening up big time. That's phenomenal. Push up a little higher. That's where I want you. You feel like that, like that. Yeah. Okay, rest. So we've shown you both those glute exercises a lot in other videos. But I just want you to understand, and we'll talk about basic technique, but his hips are square, his heel's in line with his butt, and you really want to feel like you're taking your leg back behind you this way when you sit up. You don't want to be in front of you. So his heel's right in line with his butt, and you want to be close enough in so you can grab, so you can come a little bit closer with your chest. Yeah, so you can grab there. Yeah. And now we're gonna go here. His hips are nice and square, and he's gonna come up and down. Keep your hips that square. So for him, you see how he can't touch, which is fine, but eventually he will, okay? That's what's keeping his hips square. If he lets his hips move forward, go ahead. Now he can touch. But I want it so his hips are nice and square, so then he's really concentrating on medial rotating in as he comes down. This is a minimus dominant exercise. Why? Because we're creating medial rotation. And look at here, the pad is an inch off, and that helps to create more medial rotation this way. So we want those two forces going on, hip square and that, in order to really activate the minimus, which hooks to the front of the hip head. That's why I believe it's more responsible for internal rotation and really activates more so than in the medius in this position. But medius is going to work as well here, no doubt about it. Okay. One of the things that we add on here, once I know his glutes are working properly, he doesn't have to pass a test, but he's been doing it for like a month. He's got great activation in him. Then we start adding in lower back exercise, just a bent over row with a cable, and this angle takes a lot of pressure off the back when you're trying to build it up. But you first have to, everyone tries to go in and start strengthening up the back. That's not the problem. The reason it got hurt is because of the glutes. So fix the glutes, create the support structure. The glutes hook right into they're right here. They support the low back. This is weak, then all the pressure goes in the back. So now he's ready to do this. You're not feeling any pain when you're doing it. If he did this from day one, he'd get hurt. It's good. So we raise this up. Okay, it's hard for him to arch his back when he does this. This is a very safe way to start doing a deadlift to build up the back. So we kind of combine this on day one, that cable, and then this on day two. This is a great way for him to start working the low back. So you're gonna notice the back is a little rounded. We're gonna have to start incorporating some hamstring stretches to kind of open up his spine so he can do this. And we also raise this so he doesn't have to get down as low and round out. But go ahead. So he's going to get it right in between his legs. Good. Really try to arch. There. That looks good. Yeah, that's perfect. Down. Get that arch before you come up. Yes. Good. Pressure your heels. Yep. Right there like that. That looks great. Good. Don't touch my hand. Don't touch my hand. Just yeah, like that. Don't let your knees go over your toes. Fold at yes. Good. Fold from here. Stick your butt higher up in the air. Stay right there. Don't pick it up. Put it onto the floor. Now hold it. Hold it. Oh. Just put it down onto there. Grab it. Don't pick it up. Yeah, stay right there. Yeah. Arch. There. Hold that right there. Just hold it. Put a little pressure up into the dumbbell, but just hold that. That's what I want. Now up. Yes. So every time I want you to come down, reset it now and check that. Keep that higher. Right there and up. Yeah, like that. Can you feel that?
Yeah.
Reset. Good. Yeah. Okay, right.